Okay, what I'd like to talk about today is gum disease, and basically there are several problems that can occur in the mouth. One of them is that you can get cavities, but we're not going to talk about that now. What I'd like to talk about now is the other major problem that faces us in dentistry, which is gum disease. Basically the tooth is held in position by the pink skin of the mouth, the gum. And the problem can be that that gum can start to recede for one reason or another, and I'll talk about the reasons for that in a moment. But basically the problem is that the gums start to move away. And also those people that are unfortunate enough to suffer from gum disease can notice that their gums are a bit puffy. In other words, when they brush their teeth, they spit some blood. So if you have any of those particular problems, if you're spitting blood when you brush or floss your teeth, and if you've noticed that your gums are receding, then you might want to pop along and have a consultation. But basically the process seems to be that we build up a biofilm of plaque. And what that means in a nutshell is that every day bacteria that are existing in our saliva perch onto the tooth and multiply into that creamy material that we call plaque. And the problem with the plaque is that it produces toxins, and that causes inflammation and disease in the gums. So obviously everyone knows to brush their teeth, but the problem is that very commonly we will miss a certain area and a little bit of the biofilm of plaque remains. Calcium from our saliva goes into that biofilm and hardens it into tartar. It's a little bit like in Kent in the United Kingdom where we are, we have hard water. So when we boil the water, you get this kind of calcium deposit on the element in the kettle. And it's a little bit like that. The calcium comes from your saliva, but nevertheless it's a similar sort of material, and of course you can't brush it off. So the treatment for that is that you have a visit with our lovely hygienists, and a hygienist will painlessly scrape away that material, and then they'll also show you how to get rid of the biofilm of plaque on a daily basis, and as a result we'll get rid of the problem and also we'll institute methods which are going to prevent it coming back. So that would be a visit with a hygienist. Sometimes the gum disease has progressed on a little bit further and you might need to have a treatment with the dentist. But in essence, it all boils down to removal of the tartar, the hard deposit that forms on the teeth, and then telling you how to, or showing you how to remove the soft deposits. And so the combination of those two things should effect a cure. So you may also be noticing, out of interest, that you might have a bit of bad breath as well. So this particular treatment will tackle that as well. So if any of those things are of interest to you or a particular problem that you have, then don't hesitate to come along and see us at Fresh Dental Care. We'll do a thorough inspection of your mouth and we'll press on with some painless, effective treatment. If you're interested, give us a call, come and see us. Thank you.